5 years ago, the unimaginable happened to Joan Valentine when her daughter Grace, 4 years old at the time, was diagnosed with MPS III, or Sanfilippo Syndrome. There's no known cure for the disease, and the effects are progressive and degenerative. Ever since that day, Joan has been tirelessly trying to raise awareness in an effort to find a cure. And joining me to talk about it is Joan and her daughters Grace and Julia, along with Dr. Gregory Pastores, Associate Professor in the Department of Neurology at NYU Langone Medical Center. Thank you all for joining us this morning. I really appreciate it. And thank you to Grace with her purple pom-poms, which I absolutely love. Joan, tell us how this came to fruition.
Well, I had my first daughter, Julia, and she was perfectly healthy, and all my dreams were coming true. I was so excited to be a mom. And then about 2 years later, we had Grace, and when she was about 6-7 months old, we started to notice that she wasn't really developing like a normal child. She wasn't rolling over or crawling the way she normally should, and we thought something might be wrong. So we got early intervention involved, and they started to work with her with physical therapy and special education services to try to help. And we weren't really getting very far. So after a while, we thought it may be autism because of the developmental delay, but people kept telling me that they didn't think so because she was more connected than a typical autistic child. So we really didn't know what was going on. We got genetic testing done when she was 2, and unfortunately, heartbreakingly, the doctor missed it, and he tested her for what she had, but did not come up with the correct diagnosis. He had me walk away saying that she didn't have any genetic problems. So then 2 years, we went on for 2 years not knowing what it was, and when she was 4.5, we brought her into Mount Sinai, and they basically looked at her and were able to tell that she had something called a storage disease. We didn't know which type. We had to wait 4 grueling months for a result to see if she had the type that had a treatment or that did not. And unfortunately, we found out that she had the type that did not.
But that didn't let you down, and I want to get to that in a second. But first, Doctor, what exactly is Sanfilippo?
So Sanfilippo Syndrome is the designation for an inherited metabolic disorder associated with a deficiency of an enzyme that is normally responsible for the breakdown of complex sugar molecules called glycosaminoglycans. This belongs to a group of about 50 disorders, most of which are due to an enzyme deficiency. Children can present with the problems that Grace has, which unfortunately early on in life are very non-specific. And the only way to make this diagnosis is to have a high index of suspicion and to request a particular test. And this is what most families run into as a problem, where there can be significant delay in making the diagnosis. And although in this particular instance, at the moment there is no treatment, there are ways to manage some of the problems. But the other big issue is the inherited nature of the disease, where a delay in diagnosis can sometimes lead to families having more than one affected child. And fortunately, this is not the case for Joanne and her family.
My question is, with Joan, as she and other parents, as you're planning on having a family, can you go through genetic testing? I know I certainly did that with my children. And if so, will it be picked up? In other words, is there a way to prevent this at all?
There is a way to prevent it by testing prior to implantation through PGD or even by prenatal diagnosis. But as with most genetic disorders, you have to know what to test for. And most families really are not aware of their risk until after they've had a second child. And once the diagnosis is made, then you can home in on the particular test that needs to be done. Until such time as this becomes part of a more expanded screening program in the newborn period, I'm afraid that most families will not know of their risk for this condition.
And at what age does it present itself? Does it happen as early as months, a toddler? Moms know best. You said you saw that she was not developing. You obviously had Julia. Is there a particular age where you can say, I know this is an autism, I know this is something completely different?
So most affected children actually present very early on in life, and this is a challenge for couples who have an affected child that is their firstborn, because obviously they don't have an experience to compare. And initially, it's thought of as maybe developmental delay. Some of the features include hyperactivity and recurrent behavioral pattern, which is what can sometimes lead to confusion with autism.
Mm-hmm. So, Joan, you get this news, and it doesn't stop you whatsoever. What have you been doing since learning of Grace's diagnosis?
Well, after the initial complete devastation, it hit me very hard. I struggled with ways to just maintain my own health. And when I was in my biggest state of desperation, I remember hearing a message in my head saying, "Angels will come." And at that point, I had no help or anything. And since, I've gotten help from the state, because as a parent with a child like this, you really need to find out what your resources are and get as much help as you can. And luckily, I've gotten a lot of help. And so what I've done since then is came up with an idea to do my very best to make as much headway as I can towards a cure for the disease. So I've done two things. The first thing is we started a organization called Grace for a Cure, and we hold fundraisers every year, and we've raised tens of thousands of dollars, and it's wonderful because so many people have come to help.
Sure.
And we've had a wonderful time at our fundraisers. And
the second thing is?
And the second thing is I've come up with an idea, and based on watching Grace learn with her teachers, for a game called I Can Do It with Grace. And it's a behavioral game that helps children to do the things that parents or teachers or communities or the country needs them to be doing.
Right. And Julia, you are an amazing big sister, and you wrote this beautiful letter about Grace. Tell us in one sentence or two what you think is the best thing about your sister.
Well, everything's pretty good. I can't really choose, but she's just the best sister. Like, she's a great sister. Even though she's special needs, she still has the sister stuff. Like, she has whatever you would want to have in a sister. Even though she's special needs, she's still a good sister.
And I'm sure she thinks the absolute same thing about you. Mm-hmm. Julia, Joan, Dr. Pastores, and Grace, thank you so much for joining us and raising awareness about this issue. To learn more about Grace, you can go to gracecures.org, and to learn more about Sanfilippo Syndrome, visit mpssociety.org.